Okay, so I must say that you all have been very patient all day, and we're just changing the setup quickly. But in the meanwhile, I will introduce you all to the next and the last session that we have for today. It's going to focus on Regenera Activa, the power of personalized regeneration with human smart exosomes for hair follicle regeneration. This session is powered by Akar Medical Technologies. I would like to invite Dr. Rahul Savakande, CEO, Akar Medical Technologies, for the same. A few words about him before he joins us. Dr. Rahul, under his guidance, Akar has emerged as India's premier medical aesthetic service provider. With over 20 years of diverse experience, he has excelled in general management, PLN, sales, marketing, regulatory affairs, and clinical practice, with a proven track record in managing portfolios and securing marketing authorizations for pharmaceuticals, cosmetics, and medical devices. He's passionate about healthcare improvement. Been such a long day. I think now what I'm trying to say is also not supporting me. But yeah, that's why I said I appreciate all of you for sitting here. And with that, over to Dr. Rahul. After this session, do not forget to collect your certificates at the registration desk while you leave. And over to Dr. Rahul. From here, you have 30 minutes for this presentation.
Good evening, all of you. Dr. Rahul, thanks for sitting patiently and waiting for my session. So it's a great privilege always to discuss with fellow colleagues from the industry. I did my MBBS from LTMMC Sion. After that, I was not so patient to start practice, so I decided to move on. And I joined pharmaceutical industry as a medical advisor. I was heading Galderma at one point in medical and then I shifted my focus to business and I became head of aesthetics in Galderma. Subsequently, I joined Akar Medical 8 years back and I am heading the company for last 8 years. We have 200 plus employees across India, 4 divisions, and we cater to A to Z of aesthetics. So even before I start start discussing about regenerative medicine with Regenera Activa, we are marketing regenerative medicine for last 10 plus years. So how did it start in India? Perspective is either a PRP or adipose tissue derived stem cells. So regenerative therapy goes back to aesthetics from adipose tissue derived mesenchymal stem cells, which are basically taken from human cells, and then you grow them on a culture medium and then you lyophilize it and put it as a powder, and we were marketing it as a mesotherapy for a long time. The brand name was BioCell BCC, that is BioCell Cytokines. Subsequently, we launched PRP and then GFC. Last year, we took over this brand called Regenera Activa. Now, Regenera Activa is a globally known brand. It is invented by a scientist who is based in Italy. Basically, he is also a doctor, a dentist by profession. He started his research at age of as early as 17 years, where they used to deal with pulp and they used to take stem cells of pulp and they started working on regenerative potential of the mesenchymal stem cells and the epithelial cells present in different tissues. So what started as research of dental pulp further subsequently moved on to the hair, and that is where we are today. So it is world's first and only autologous micrografting technology that is available worldwide. Now, exosome has been known to world for a long time. These are extracellular vesicles, but utilization of exosome as therapeutic potential suddenly came into light in last 7 to 8 years. Majorly, it started in Korea. The discussion started in Korea. They started doing research. There are almost not more than 16 studies, well written, well published, where they have documented results of exosomes in therapeutic potential. And the first study ever done and published reports was for atopic dermatitis, use of exosomes in management of atopic dermatitis. Subsequently, like I said, adipose tissue, so these exosomes were derived either from Wharton jelly, that is the placenta, or adipose tissue derived growth factor, mesenchymal stem cells. Now, the problem identification here is whenever you are using an autologous therapy, you don't have any risk. Whenever you use a heterologous, a tissue like a placenta or a fat, which is not your own, there always is a risk. Okay, globally, if you say US FDA has not approved any exosome therapy worldwide. And the reason is there is certain amount of apprehension that when you are using multipotent stem cells, especially adipose tissue derived or mesenchymal stem cells from placenta or cord blood, there is always a risk that these potential pluripotent and multipotent stem cells can differentiate into other cells, and it can lead to certain other side effects or adverse effects, which we will not discuss as part of this meeting. Now the other problem is none of the exosome companies have been able to prove immunotolerance data. So the latest US FDA product that failed came from Korea, which they tried to reach phase 3 and they lost their approval because they could not have enough data on immunotolerance. So in that light, Regenera Activa autologous exosome therapy becomes very important. Now Regenera Activa as a company has been marketing autologous micrograft in various therapies, hair being one, which we have marketed and registered in India, but they also use it for vitiligo management, they also use for your knee joint. So instead of replacement, the cartilage regrowth, they're using orthopedic indications, diabetic foot, diabetic ulcers, management of. US Army has a specialized kit that they use for expedited wound healing by using your own body's tissue. It is also used as a common solution preparation for hair transplant. So they prepare, instead of using other medium that is used for storing the hair implants, they use regenerative solution prepared by autologous micrografting. So keeping this base in mind, I'll take my presentation further. We have more than 80 scientific studies. It is patented across 30 countries. It is pioneer in micrograph technology. It's most advanced. Currently, it's most advanced company with autologous micrografting, and their therapies are further improving, like cardiac implants, cardiac transplants, liver transplant, where you can use autologous micrografting and mesenchymal stem cells. And this company is present in more than 60 countries now, India being one more. Last year, during period of August to October, that is when we were the first company in the world to document exosomes present in the autologous micrograft. So what we have done is a research with a University of Spain, and there is an independent institute also, where we were able to find that there are exosomes present in our solution. Okay, the solution that we are able to get through autologous micrografting technology. Basically, the autologous micrograft contains progenitor cells. Now, the progenitor cells have both therapeutic effect, and the major benefit of progenitor cells and where it is used is to heal and repair the tissue. We also get the extracellular matrix, which is again helping in the epidermal cell turnover, mobilization, and multiplication. The key features of regenerative therapy is, first, it is autologous and it is derived from mesoderm. Second, it helps in precise signaling specific to hair follicle, dermal papilla, your bulge, your pericytes. It also helps in angiogenesis and managing the immune response that is present due to androgenic alopecia. So basically, what are exosomes? Messaging cells. There are extracellular vesicles. They carry DNAs, RNAs, lipid. They carry certain cytokines and growth factors that send message from one cell to another. A healthy cell to healthy cell, or tissue-specific cell like a hair, so a dermal papillary cell to a dermal papillary cell. Now we have a lot of, like, as Akar, a company in aesthetics, we are ourselves marketing adipose tissue derived growth factors and stem cells, plant derived, but the results of autologous will be always better than the heterologous tissue. Okay, the results will never be similar. So what happens is, if the message is different, the colors of message is different, the cell will not always respond. What we require? Autologous tissue, tissue-specific messaging mechanism or signals or growth factors, and then the tissue will be having effective regeneration. And that is why Regenera scores over other regenerative therapies today. So when we are using plant, it is not autologous, not tissue specific, hence not as effective. Now, will you say it is completely ineffective? No. The mRNA structure of most plant-derived exosomes is similar to the human exosomes, and that's why they have application in day-to-day aesthetic therapy. Same applies to your umbilical cord or bone marrow or adipose tissue derived exosomes. Their structure is close to, similar, not same. Okay? So with Regenera, we say it is a smart exosome because it is tissue specific, it is autologous, it is completely safe to use in patients with no potential of carcinogenicity whatever. Why? These cells are very specific. They will multiply and give specific tissue cells only. So we give up to 55 billion of exosomes. They are first autologous and tissue specific in the market, personalized agents to modulate inflammation and healing, no manipulation, maximum safety, and today it is scientifically proven to have, so nobody has been able to quantify how many exosomes are present in any. Like even if you get exosome therapy from other companies in injectable form, they say 5 to 8 billion. I think the maximum a company has claimed is 8 billion exosomes per ml. Here we are getting 55 billion, and that is autologous. So that's how the device looks. This device is a rotator device. It rotates a tissue in a specific speed of 80 rotations per minute. So it will rotate the tissue. So this is a specific cone. So like this, there are very specific cones for cartilage, for adipocytes, for cardiac and other indication. What differs in this rotation is, you see there is this blade which has holes. There are 100 holes which will disaggregate the tissue for a particle size of 80 micrometers. Now why 80 micrometers is important is, when you are injecting them through a 30.5 gauge needle, the stacking will not happen. The needle will not get blocked. Also, that is the particle size of most exosomes, mesenchymal cells. So what happens is, when the rotator tissue is rotating, the tissue is getting disaggregated, it doesn't damage or rupture the cells. So what you get is a wire cells that are injected into the tissue. So we have conducted studies in University of Ferrara and Barcelona. There are specific now clinical trials being conducted with exosome identified with various CD markers, CD 81, 63 and 9. So if you see data here, which is clearly showing different markers for the exosomes present in the solution that we generate from the tissue disaggregation. So basically what we get here is exosomes, extracellular matrix and progenitor cells. So that's what we called is, we are injecting a triad of exosomes, progenitor cells, that is mesenchymal stem cells and similar factors, and also the human smart exosome. Volume? Basically, what this video is showing is this is your hair bulb and the dermal papilla, and what happens is usually in androgenic alopecia, the androgens they attach to certain specific receptors and the beta carotin receptors and prevent beta carotin expression and SH expression, and thereby they stop messaging between the dermal papilla and the epithelial cell. And what happens in return is, because the hair follicle unit is a recycling unit, if the messaging from the mesenchymal stem cells doesn't go to the epithelial cell, the cell cycle shortens. So the catagen phase and the anagen phase is shortened and telogen phase is arrived, and the hair fall. There is miniaturization and the hair starts falling. So this is how we rotate the tissue, which we take 3 punch grafts from our occipital area. We get this triad of progenitor cells, exosomes, and extracellular matrix. So basically what we are doing is we take healthy mesenchymal stem cells and progenitor cells from a hormone sensitive area to a hormone resistant area. What happens is the mesenchymal stem cells and the progenitor cells, which are healthy, when they are injected in tissue diseased area, they start normal messaging mechanism through paracrine system. So they send certain growth factors, cytokines and exosomes, and the messaging between the diseased mesenchymal cells to the dermal papilla is improved. And what happens is, because of this improved messaging, the cells start duplicating, they start growing again, and the hair cycle is restarted. This therapy will not work beyond grade 4. It is a classical product required and only to be utilized between grade 1 to grade 4. Why? You require a viable follicle. The follicle either can be a dormant follicle or a diseased follicle, but the follicle has to be there. You cannot expect result where there is no follicle. So if you have miniaturization, if you have a dormant follicle or a spot or a single hair follicle, you will 100% get result. So the recent data now with 3 punch grafts, we don't require more than 3 punch grafts. Additional punch grafts don't give any incremental benefit. And I'll also tell you why we require a punch of only 2.5 mm. So basically what we see is there is increased hair density within a month, increased number of hairs, and cumulative hair thickness is increased. If you see this trichoscopic evaluation, what criteria the patient should ideally fit is the frontal area number of hair has to reduce, the thickness of less than 30 micrometer of frontal area, the hair should be thin. So the criteria is 30 micrometers. Single hair follicles are more in the frontal area, and you have empty follicles in the frontal area. Class 1 to 4, you will get the best results. That's how the device looks. Like I said, there are 100 hexagonal holes with 6 microblades, and the tissue is cut off. The disaggregation happens at 80 micron level. what you do is you take the occipital area and toward the hairline you draw a line, and midpoint of that line you use the area. Why this area is utilized is because it has the highest vascularity, and when you are doing the tissue here is the most healthiest for injecting automicrografts. Again, it is hormone resistant. It doesn't have any hormone specific action because of androgen. So that's why we choose this area. We are using 2.5 mm punch, 3 punches. So why we use 2.5 mm punch? Because you don't need to suture, there is not too much of blood loss, and it can be easily covered with a bandage. You don't need to do any suture or anything. It's a very easy to do procedure, and it can be finished within half an hour. The data has shown that with single punch you will get 8.5 billion exosomes. With 3 punches you get 55 billion exosomes. But further increasing the exosome number increases, but the result doesn't change much. So you put 3 punch grafts, and then you put 1.8 cc of normal saline, and then you put it in a machine, and then you first tap. So each tap gives you 1 minute of rotation. So the second rotation again of 1 minute. You again put 1.8 ml of cc. So you will take 2 syringes, 1.8 cc each. You will get solution inside. The second rotation you can just do manually. The first syringe will contain the high concentration. The second syringe will have low concentration. So now you put a connector and then mix. Now with 1.8 cc in both the syringes, you dilute it further up to 3 ml with normal saline. So you will get 2 syringes of 3 ml each. So in total you will get 6 ml. So here we have not done any local anesthesia, it's completely painless. The particle size is 80 microns and it doesn't cause any pain to the tissue or the person. But everybody has a very different pain. You can always choose to use anesthesia. While doing the you only do injection anesthesia without adrenaline. So again the same thing, we are using a highly vascularized area, hormone protected area. It's rich in progenitor cells. It is safer because it's behind and it's a sun protected area of hair. We are using 2.5 mm punches. Slide वहाँ से change हो रहा है क्या? So the injection happens at a specific depth of 4 mm where the dermal papillas are present. So ideally you should always inject at a depth of 4 mm. All hair mesos we recommend to be injected at a depth of 4 mm. How frequently can you do Regenera? So Regenera, since it's an autologous micrograft, progenitor cells and mesenchymal or exosomes, once it is injected in the deceased tissue, it starts its own cascade of mesenchymal proliferation and the progenitor cell stimulation. You don't need to do it again within 1.5 to 2 years. So it's a single therapy and the results last much longer. Now many doctors or people question that do we need to continue minoxidil or any other hair fall therapy, DST? Hair fall is diabetes. Your androgens will keep coming, you have to stop them. Here what we are doing is because of the excessive androgen, what hair cycle was stopped. The hair cycle was stopped. We are reviving the hair cycle, but the androgens will keep coming. So what you need to do is still keep giving minoxidil to prevent what has started now. So earlier you did not stop the androgen effect, now you can stop, but the hairs will regrow, but they will fall again if you don't stop the androgen effect. So you 36.5 G needle, 1 ml, 0.1 ml per centimeter square, 4 ml depth. This solution we have tested with multiple cell lines and it shows increase in cell survival time. It also shows increased wound healing through ERK induced cell migration. These are results of a clinical study. So in most clinical study we say increase in mean hair density, increase in thickness and the number of cells. These are Indian doctors. Main benefits is shortens the telogen phase and increases the anagen phase and delays the miniaturization further. But as I said, gold standard minoxidil or oral minoxidil or any other DST inhibition has to be continued. You are regrowing, regenerating the hair follicle, re-stimulating the hair follicle. Unless the androgen effect completely ceases, you need to continue it. Because people have recommended patients that, okay, this therapy, you don't need to do anything after this, is completely false. And then the patient comes back to you saying, sir, mere baal वापस चले गए. And it's a costly therapy. So please be specific that it's like diabetes, you need to keep doing DST inhibition. So thanks a lot for patient listening, and queries if you have, please feel free to ask. Yes, ma'am. Above 18, anybody, ma'am. Ma'am, you need a existing hair follicle, and grade 1 to grade 4, any age is okay. Ma'am, there is no age limit, ma'am.
Above 60, 70, yes, we can do it?
No problem.
Okay. Thank you.
Since it's completely autologous, unless you are on aspirin or clopidogrel, where chance of bleeding is slightly high, there is no other precaution.
Yeah, that's what I want to ask. What are the contraindications?
There is no contraindication because it's autologous completely. Okay. Unless there is local infection or anything else. The only contraindication is it is beyond grade 4. Even beyond grade 4, it can be used, but then the patient should be aware that what is remaining will survive and there will be slightly more growth, but you cannot get a full. The other important thing that as a business person I would, it's not from business point of view, we get a lot of queries that patient says result nahi aaya. Now there is a photographic evidence, result nahi aaya. But if you see, most times the photograph is taken in a way, the hair parting, even in these photographs, I am not very happy with the photographs. I recommend doctors usually to trim the hair. Take it at 3 or 4 level, the shaving level. Because what happens is then your before after is justified. Then you will visibly see the result, visible thickness. Because the hair parting thing, it can be parted in a manner or you put hairspray and say baal aa gaya hai. It could be that. So the best way to document the hair in such costly therapies, PRP or GFC, is to cut the hair short so that the patient actually sees growth. And like we had a medical legal session today, we get a lot of queries on medical legal things, especially skin lightening products or anti-aging products or the claims that we do for hair. We face a lot of such queries. So my recommendation would be always trim the hair. It's always, I know most patients will not allow you. Or you have a trichoscope and the area very properly marked so that the patient comes. Because today, take it in return from me, any patient of aesthetics has some amount of body dysmorphic disorder. And the second thing that you need to know, and I don't know if it is 100% true, but when you see self-image in mirror, it takes about 3 weeks for you to realize change. Because your body, when it's seeing yourself every day, a slight change is not visible because the brain has that imprint of your face which doesn't change. It takes time for them to register change. So photographic evidence, documentary evidence in terms of softwares and other things will always help you. Otherwise, patients are really bad and I get calls for such kind of things. So be safe and I think counseling is most important in this. Hair? Ma'am, hair transplant is post grade 4. It is actually delaying hair transplant. So lot of doctors in Europe are using it with hair transplant. Like I said, they take 50 grafts, that is a separate cone, in which they disaggregate the hair transplant and they use those grafts. So they use 2 cc for injecting in the graft and the rest of the 12 cc is used as a in which you keep the hair grafts. The solution in which you keep the hair grafts. So it is used concomitant to hair transplant in especially most clients in Europe and Middle East, and so it is used together with hair transplant.
Okay, so I think that brings us to the end of this session and the day. But just before you all leave, be a little more patient with me for 2 minutes because let's thank Dr. Rahul for his time and all the information that he shared.
एक मेरे पे मोबाइल से लेना. Sales team and my team, after a long time I'm presenting. Earlier we used to do a lot of CMAs with dermatologists and cardiologists. So the first time I'm talking to a group of aesthetic doctors. Thanks a lot for patience.
Thank you so much. And with this, we come to the end of Aesthetic Medicine Conference 2024, Advancements in Clinic Management and Patient Care. I would like to thank each one of you, especially for those of you who've stayed back till the last minute. Thank you for being with us. Thank you to all our speakers, all our panelists, all our partners. Our two-day event was supported by Silver Partner Vocard Regenerative and Conference Partner Clinicio. I would like to thank the Aesthetic Medicine India team because I know I've been the one talking to you all, but I have a whole team over there that has been working to make these 2 days successful for all of you. So thank you so much. Please do not forget to collect your certificates. It's right here outside at the registration desk. And I will look forward to staying connected with all of you through our Instagram page, through our magazine, and with our show next year and many more shows and events that we are going to come up with. So we'll stay connected and thank you so much. Have a great evening and have a successful year ahead. Thank you. Yes, you all can clap for me as you all leave. Thank you so much.